Alright people, so let's look at another case of radiology. So you have a case right in front of you, alright? And this case presents to you a patient with a history of HIV with a CD4 count of less than 200, specifically 120. Here is the question: what is likely the cause of this person's infection? And here he is presenting with this chest imaging. Pause the video and let me know what you find. Alright, so now that you've paused the video, let's discuss about the abnormal finding. The abnormal finding is that this patient has specifically a perihilar interstitial lung disease / reticular pattern. Now, I'm pretty sure you might be confused as to what I just said, but the description is quite specific. It showcases what the patient's problem is. So, let's look at the patient's case for a minute, yeah? Whenever we have a patient that's HIV positive, as we obviously know, a patient with HIV, he'll be immunocompromised and he'll be liable to infection, especially pulmonary infection. And in the case of pulmonary infection, HIV patients are susceptible to a fungal infection, that is Pneumocystis jirovecii, or its previous name, Pneumocystis carinii infection. HIV positive patients are especially susceptible to fungal infections such as Pneumocystis jirovecii, to the point that whenever their CD4 count is less than 200, they start to be susceptible to this fungi and they start to present with pulmonary symptoms. So think, you can think, for example, cough, a non-productive cough, chest pain, shortness of breath. You take a chest x-ray and you present with this finding. And I told you all this stuff about this Pneumocystis jirovecii because this is what should be likely in your mind. It should be an opportunistic infection in an HIV patient. And that's why it is important to have a patient's presentation be linked to the imaging so that you know what to look for. Now, in this patient's imaging, we have a problem that is specifically seen in the lung interstitium. So when I look at the diaphragm, if I look at the hemidiaphragm and I look at the Coster-Phenix angle, the sharp ones, they're normal. When I look at the ribs, on the chest wall, overall, the ribs, the clavicle, the shoulder, this side, as well as towards this side, they're relatively normal. When I look at the mediastinum, let's look at the mediastinum. I can see that the mediastinum, the middle structure, it is normal. The contour, the shape of it, it is normal. The trachea, the heart, the ascending aorta, everything is normal. And when I look at the hilum, I look at the hilum, overall it's normal. And when I say the hilum, I mean the central structure, right? The central structure containing the blood vessels, the lymph nodes, they're relatively normal. There's no enlargement overall assessing the hilum, all right? Now when I look at the lungs itself, when I look at the lungs, the black fields, the interstitium, which is what is composed of the lungs, I notice an abnormality. I notice an abnormality here in the central structure. I notice that there is further, you could say, further widening of the interstitium, or further, you could say, enhancement of the lungs interstitium. And I'll tell you shortly what I mean by that. But I want you to know that perihilar, meaning very close to the hilum, there is a widening. There is an enhancement of the lungs interstitium towards this region, all right? And when we look at the left side, again, the same issue. Specifically, this entire region, there is enhancement of the lungs interstitium, all right? In fact, there is ground glass opacification or suspected ground glass opacification. It means there is a ground glass appearance, which pretty much looks like this region right here, all right? A ground glass appearance. If you've ever seen a ground glass, it pretty much looks like this image right here, or this image. This is a CT, but you get the point, right? They resemble the ground glass. Now, it's very clear on a CT, but you can get an idea on a chest x-ray as well. So you can see it right here as well. Now, to understand what I mean, I want you to compare this imaging with this imaging right here. This is mostly a normal chest x-ray. There's an abnormal finding, but this is mostly a normal chest x-ray. Take a look at the interstitium. take a look at it. This is the hilum, and from the hilum comes the blood vessel that is very obvious in the central, and then it spreads towards the periphery where it becomes less visible. Compare this finding, this interstitium, to this finding. Now you'll see a very obvious difference, right? Compare it, these findings, these interstitium, to this interstitium, and you'll notice a very obvious finding. What is this obvious finding? Well, with the help of MS Paint, you'll get the picture even more. So if I look at MS Paint real quick, let's imagine, let's assume that this right here is the lung interstitium, right? This whole thing is the lung interstitium. Now, the circular structure is the hilum. Now, the hilum here, it contains, the blood vessels, the pulmonary blood vessels, and it also contains the lymph nodes. The lymph nodes, they're not visible, but they overlap the pulmonary blood vessels. They're seen in this central structure, known as, the hilum. This is known as the hilum. Now, when I look at the hilum, I can see from this hilum is a blood vessel that's spreading out. It's spreading out. And it's spreading out in this picture right here, right? We have a blood vessel right here. I could pretty much draw it, I could pretty much draw it. And when I draw it, you'll see that this is the blood vessel. Whoopsie daisy. This is the, oh boy. This is the blood vessel, whatever. This is the blood vessel right here, right? This one right here. Now this blood vessel, it will spread out, and when it's spread out, it becomes thinner and thinner and thinner, because the blood vessel, when it spreads out peripherally towards the chest wall, it becomes thinner. So this is the blood vessel, but now it becomes thinner and now becomes less visible. So let's summarize. And this is the lungs interstitium, the background of the lung on a frontal X-ray. We have the hilum containing the lymph node and the pulmonary blood vessels. They're very big, but they start to spread out, specifically the pulmonary blood vessels. As they spread out, they become thinner and more thinner, more less visible, very less visible as they spread out peripherally as well. Now, in between each pulmonary blood vessel is an alveoli. You see this black background? That's air. Air appears as black. It appears as lucent as a chest X-ray. And what is containing air? What structure contains air? Alveoli. So in between each pulmonary blood vessel contains air, contains alveoli. Now, this is what normally a lung interstitium looks like, all right? This is what it normally looks like, in which you have a interstitium with pulmonary blood vessels being very visible in the center. Then they spread out towards the periphery, and when they spread out towards the periphery, they become less visible. And with each pulmonary blood vessel, there is an alveoli, which is black. And of course, one other information to be added, you also have the bronchioles. Now, the bronchioles, by the way, the bronchi, they're also present in the black background, right? They're also present in the black background. They're present, but they're invisible because, again, they're composed of air. So you're not going to see them as well. So the black background, it is composed of alveoli and is composed of bronchioles and bronchi. So this is what the interstitium is composed of. Now, if we come back, we'll see what we mean by that. Here we will find that we have the alveoli, we have the bronchioles, they are composed of air, and we will find the pulmonary blood vessels. You'll see they're very prominent. They're prominent on the center, but they're also very prominent towards the periphery, as compared to this normal finding, right? They're very, very prominent towards the periphery. Also towards this side. Compare this picture, right? You compare this picture towards this picture. You can see the difference. How we have a pulmonary blood vessel, they spread towards this side, but they're less visible. But if we look at this picture, they spread towards the periphery. So we have here a case of interstitial lung disease that is in reticular pattern. A reticular pattern is like a line. It's a line, basically, a reticular pattern. And we have a case of diffuse interstitial lung disease, reticular pattern, bilateral. Bilateral meaning two sides, Bilateral perihilar, or you could say perihilar as well. So if I have a case of a bilateral or perihilar interstitial lung disease reticular pattern, and this is found in a case of an HIV positive patient, then I am more than likely to suspect HIV positive associated pneumocystis jirovecii infection, a fungal infection. All right, I can take a I can take a CT scan to confirm my case. All right, that's pretty much it.